Kishore Gadiraju, the Chief Evangelist of TALHospitals, brings a unique blend of technical expertise and a deep passion for addressing healthcare challenges. As the Vice President of Engineering at Solix Technologies, he combines his professional prowess with a heartfelt commitment to serving people. Kishore's vision led to the creation of the TALHospitals platform, which aims to tackle the pressing medical issues that touch the lives of countless individuals. Through his leadership, TALHospitals has developed an innovative app that connects patients in need with pro bono healthcare services. This app is a testament to Kishore's dedication to making quality healthcare accessible to all, leveraging cutting-edge technology and his unwavering passion for improving the well-being of communities.
Again, my name is Kishore Gadiraju. I'm the VP Engineering at Solix Technologies. I also work on TALHospitals under TALTalks Foundation. I'll briefly talk about TALHospitals, what we're doing, how we're doing, and give you some more information and see if you can help us support this initiative. So with that, again, a brief introduction. I've been in the software development industry for 25 years, working on various projects, products at various companies. I work for Sun Microsystems, I work for Network Appliance, and right now I'm working for Solix Technologies and supporting TALTalks at TALHospitals. So that's my quick introduction. So I think you might have seen TALTalks umbrella. There are many verticals. There are many leaders driving these verticals. I focus on the TALHospitals part of it. So again, I'll talk more about TALHospitals, but just want to give you a bigger picture in terms of what is in TALTalks Foundation. And we started this initiative, again, I would say 10 months ago, less than 1 year. So we've been in the TALTalks for other initiatives been started earlier, but TALHospitals just started 10 months ago. I'm very proud being part of the TALHospitals. We have seen the potential and we have seen the impact we can make with TALHospitals. So just very high level, the overall vision, what is that we intend to do with the TALHospital vision, right? So again, we want to enable healthcare services for people who are in need, either irrespective of their socio-economic, geological conditions or restrictions. We want to enable a good healthcare for everybody. So that is our bigger mission. Mission. So what we've been doing is how are we going to accomplish this? So we're going to partner with the people. We're going to partner with hospitals. We're going to partner with doctors, individuals to make it happen. So in the process, we also wanted to enable this platform for propagating new innovations, new medicines to the doctors and all the practitioners. And we also wanted to enable the platform for innovating new medicine in the industry. So we want to enable this information to pharma companies so that they can use this information to innovate some new medicines in this space. So that is our overall vision and mission. Again, so the overall solution that we are developing in TALHospitals is that, as you can see in the diagrams that we started at the bottom, we allow members to register on our platform. Again, it's a completely pro bono service, 100% free of cost. Anybody can join TALHospitals, and whoever is already joined TALTalks already automatically become a member in TALHospitals. So once you become a member, you can request for any medical healthcare services if you really need some help here. And what we do is we onboard doctors who are professionals, and we also onboard facilities or hospitals onto our platform. So we try to find a match based on the member's request. If they need specific service or a kind of a procedure in a specific vertical, specific area, we connect the specialists in that area and the hospitals that provide that service together so that we can provide service to the members. So in this process, we track all the activities that are happening for the particular member, and then we closely monitor, we work with the patient or the member, and we make sure he's completely getting the right service, right throughout that particular journey, starting from onboarding to identifying the doctors and hospitals and following up with the procedures, making sure that the entire cycle has been taken care of. So, and in the process, there are two outcomes within the process that we are also focusing on. One is there is a lot of innovations happening in the healthcare industry, right? So a lot of people may or may not be knowing about what new medicines are coming out, what new advancements are coming up in this industry. So we are enabling that kind of information through our platform. And also, as I said, we are enabling the information that we are gathering in a non-intrusive way, in the sense masked or encrypted way, so that this information can be useful for pharma to come up with the new medicines from the platform. So that's what we are aiming to achieve. And we have already built, within the last 10 months, we've built the platform, and the platform is available online today. Anybody can become a member. Please visit us at TALHospitals.org, and then you can register online by yourself. And we also have a mobile app that works on iOS and Android devices. You can download the app and start using the application. In the last 10 months in our journey, we met with so many doctors, we met with so many hospital organizations, we met with governments. So when we shared our vision, when we shared what we're trying to do, we have seen a lot of support, encouragement for this initiative, and with that encouragement and initiative, what we're trying to do is we are building these partnerships with these hospitals, governments, and individuals who are willing to support us. Doctors and things like that. So that's what one of the key focus that we are working on right now. And I will share some of the partnerships that we are currently working on to make a bigger impact here. We are also talking to a lot of doctors to inspire them to do some voluntary work. So high level, what we are pitching to them is that, obviously they're very busy with so many other commitments for their day-to-day job. And what we're trying to do is we are telling them, if you even do one free pro bono service per year, just one service per year. And once we bring all these doctors and hospitals into the platform, we are building the largest digital hospital in the world, even if they do one free service per year. And the same thing with the hospitals. If they do one free service per year, and we are building the largest digital virtual hospital with our platform. So that is the kind of impact we're talking about. So we talked about, in this process, we are also integrating with emerging technologies. So because we are building the platform, right? We wanted to leverage technology, we wanted to integrate with some of the latest developments. For example, so we have been integrating with some of the AI technologies. That means you can always think about, you have a virtual doctor available online to answer any of your general questions. So if you're not feeling well, or if you have a specific question, you can just ask that question on our platform, and just like as your doctor responds, it will give you the results in the sense, hey, what kind of symptoms you have, and maybe what are some of the preventive actions you can take, what are the precautions you can take. But if something serious, obviously you have to go to the doctor. But the first level questions, clarifications can be asked on the platform itself. So we have already integrated, we have a digital assistant to answer the medical questions that are already available online. You can try it out. We have integrated with, we're trying that particular AI model with medical data, and it's available online for you. So I think we talked about bring awareness to the doctors on this new innovations, medicines and things like that, and we also help innovate new medicine. So in the last, in terms of where we stand from SDGs, again, I think you're already familiar with it. We are on the number 3 part. We come under this number 3, the health and wellness, the well-being intersection from the GDP perspective. That's where we stand. Coming to the progress and accomplishments in the last 10 months, that what we have accomplished in the last 10 months. There are 2 sections here. On the left-hand side, you see the development on the technology side. On the right-hand side, you see some of the partnerships that we are working on. We're almost completing the partnerships. So on the left-hand side, we build a platform. It's available online. You can visit us at TALTalks.org and register and see what we're offering. And then we build the medical chatbot to answer any general medical questions. It can be what is diabetes, or what is are the problems, what are the causes of the problem, what are the preventive things that we can do to avoid it. So you can ask all those questions on the platform. So you always have your own personal doctor online to answer those questions. So we also have integrated with another chatbot called Palm2 from Google. So that's also available, coming live next week. The difference between the one that we have already integrated versus what is coming up next week is that the first one we've integrated with a limited set of data. Just like we trained with limited set of data, so it can answer you with that limited set of data. But with integration with Palm2, this is a real live system that the moment you ask a question, it will let it go online, gather information, and get to the response within a few seconds. This is almost like a real live doctor. So we want to give that choice to the member. So and just to add to that, right? The Google Palm2, the Google actually is training this model with the real medical content, and they've already certified to become a real doctor. They've been going through some real tests online, like what typically doctors go through, and this particular AI chatbot passed all those tests. So that means we can really qualify that there is a real doctor online as a chatbot available for answering any questions. So this has been, a lot of people have started using it. We've been integrating into our platform so that, bottom line, you have your own doctor to ask any questions. So that's a very good option that we're enabling online. So that's some of the advancements or accomplishments on the technology side or integration side. On the right-hand side, we've been working with multiple organizations who are willing to support us in this initiative because it's a pro bono service. So we are starting with, we submitted 3 MOUs, the government of Karnataka in India, and this particular state has close to 60 million population. And once we complete that, the signatures are signing of that, we are expecting any time now. We will be getting access to 60 million people. They have thousands of hospitals available there to support people who are looking for some health care. So that's another big opportunity we are working on. And there is another organization called Sri Madhusudan Sai Institute of Medical Sciences and Research. And this organization has 14 multi-specialty hospitals across the world. And they have one in Sri Lanka, they have one in Fiji, they have a bunch of hospitals in India. They're actually, in fact, building one in US. And this organization is 100% free or pro bono service. Any medical thing that they support, anybody can just go there and no questions asked, 100% free service they provide. So we are partnering with those kind of institutions to support our members so that we can connect them together. So there is an easy way to get that kind of help. And we've been very closely working with them, and we're again signing a contract with them. And we're also working with the Heartfulness Institute. Again, they have offices in India, they have offices in US to help us similar services. So we are integrating with them. And we're also signing up a partnership with a company called Multiplier AI. What these guys do is they collect information about doctors across India and US, and they gather information about those doctors, and they rank them, and they capture all the information about them. So we are trying to onboard all those doctors onto the TALHospitals platform so that we can enable more access to more doctors on the platform. So these are all some of the accomplishments in the last 10 months. One is on the platform side, one is on the partnership side. So I would say we made a lot of progress in less than 1 year, and we are adding more and more partnerships, and we are enhancing the platform to make it easier, to make it simple. Just to give you an example, right? Not everybody can use a platform like a web application or a mobile and things like that. So we are enabling in such a way that they don't need to type what are the problems they have. They can just speak. They can just talk about, hey, this is my problem, kind of a thing, and the system will automatically record the problem, and it can provide that information to the doctors or professionals that are looking at it. So that is where we are heading from the platform perspective. Again, this is a screenshot of the AI chatbot we have integrated on the platform. It's available. Anybody can go use it right now, and it can answer any of your typical questions. that you might have about any specific problem, what are the causes about it, what can be done to prevent it. So all this information you can ask that question on the chat. In terms of the support, I would like to take this opportunity and ask all of you to join us in this journey. Again, the website is available, applications available on your mobile apps or on that. Please join us, and support people who are not privileged to have this kind of access. And again, please share this information with your friends, families, and see if you're interested to support this cause. And then, we are here to help support any other questions you might have or onboard more members. And again, finally, I would like to be, I want you to be the catalyst, initiate this change, so that you can spread the message. So that's my ask for today. And again, anything to do with charity, again, should be listening to your heart and then do something about it. That's my conclusion for today. Thank you for giving me this opportunity, and let me know.